We've seen COVID spread quickly through places where people live together in those close quarters. But researchers say those same antibodies used to treat people with COVID may be able to prevent outbreaks. Tonight, CBS 17's Maggie Newland is getting answers about how this would work. Maggie, this is all very interesting.
It is, Angela. A number of nursing homes around North Carolina participated in a study on these antibodies, including this one here in Raleigh. Now, right now, the antibodies are used to treat people who are high risk who have been already diagnosed with COVID. What doctors want to know is whether the same treatments can help prevent people getting sick when they're exposed. As COVID spread, Lynn Hood worried for the people who live and work at nursing homes she oversees.
When people are congregated, this virus takes off.
Even strict infection controls can't prevent all cases, but researchers are studying whether monoclonal antibody treatments can stop those exposed to the virus from getting sick. Lynn's nursing homes got the chance to take part in a clinical trial.
We said, you know what? If we can save one life, then we have to participate in this.
The idea that you can use these therapies to interfere with the chain of transmission of COVID-19, especially to vulnerable people, is really important.
UNC doctor David Wohl worked with the nursing homes and drug maker Eli Lilly, which sent an RV outfitted with everything for the study to facilities with COVID cases. It arrived when 2 employees tested positive at Harmony Hall in Kinston. Administrator Hope Vick didn't hesitate to get the IV infusion available to staff and residents.
I wanted to do anything I could to protect myself, my family, the residents, my employees.
Dr. Wohl says study data shows promise for people in nursing homes.
In giving an infusion through the vein to staff and residents, it was found to decrease COVID-19 disease from getting sick from COVID-19. 80%. It's pretty remarkable.
And while antibodies aren't yet authorized to prevent COVID, study participants hope many others will eventually benefit.
It was a very rewarding experience just to know that I was involved in something that could protect millions of people.
The only word to describe what they brought to us was hope. Hope that our staff would be safe, hope that our patients would be able to see their families again, hope that we could someday return to normal.
Lots of people hoping for that. Now, again, these antibody treatments are authorized right now for emergency use for people who are high risk and have already been diagnosed with COVID. Dr. Wohl says he thinks that the company that makes the drug will apply for emergency use authorization to use them as a preventative within a matter of weeks. We're live in Raleigh. Maggie Newland, CBS 17 News.